Raptors can be found anywhere. If you look carefully, you can find them on light poles, fence posts, flying gracefully in the sky, even perched in people's backyards. You'd be amazed at how many probably live in your neighborhood. Watching these amazing athletes fly is truly spectacular. Unfortunately, the world they evolved to fly in has changed dramatically. Birds are injured daily when they come into contact with hazards such as cars, windows, power lines, and soccer nets. Even worse, some birds are illegally shot or live in an environment contaminated by chemicals. The Raptor Center at the University of Minnesota is a world-renowned hospital that specializes in the critical care and medical treatment of injured raptors. Between 600 and 800 raptors are brought to the Raptor Center's medical clinic each year. The center provides on-site training for veterinarians and veterinary students, provides lectures and workshops at conferences, and consults with professionals throughout the world. It also uses clinical data to identify and monitor issues threatening raptor populations in the wild. Dr. Julia Ponder, Executive Director of the Raptor Center, explains that raptors are brought into the clinic in a variety of ways.
The community is a huge part of our program. People know about our program and call when they find an injured raptor. We have volunteers who respond to calls from all over the state and transport the birds to us.
The Raptor Center is staffed with some of the leading clinicians in the world for raptor medicine and surgery. Each bird that comes in receives a complete physical exam by the specially trained staff, who then decide on a treatment plan for the bird. While not every raptor can be saved, the exceptional medical and surgical care of the Raptor Center staff provides their best chance for survival. When a raptor arrives at the Raptor Center, it receives an extensive exam, including a beak-to-talon evaluation, radiographs, basic blood work, and an eye exam. Often, these birds arrive days after their initial injury or illness. They may not have had anything to eat or drink during that time, nor any ability to find a safe haven. Their injuries are compounded by starvation or exposure. They require the ultimate in critical care. Experts in avian medicine and surgery, the center staff works quickly to evaluate and stabilize the patient. The ability to triage or prioritize a treatment plan for maximum success is essential. Knowing what must be treated immediately, what should wait until the patient is stable, and what cannot be treated is an art as much as a science. In addition to their own expertise, the Raptor Center staff benefits from the knowledge of the specialists at the University of Minnesota's College of Veterinary Medicine. Eyesight is critical for raptors to be able to successfully hunt. Knowing this, the college's veterinary ophthalmologists often contribute their skills and knowledge to help these birds. As part of the admission process, the center collects samples and data for future studies. Each raptor that enters its doors provides a piece of information about the health of the natural world. The clues they provide help to identify the challenges they are facing in the wild. Admission patterns may reflect alterations in urban populations or reveal hazards from changes in the environment. While many hazards such as pesticides, power lines, and cars are known, new ones occur every day. The cumulative knowledge gained from the individual birds provides a window into the world in which they all live. While some of the raptors treated in the center's clinic just require supportive care, many need more advanced skills. The Raptor Center staff is internationally renowned for its expertise in avian orthopedics. The techniques used at the center were developed by Dr. Patrick Reddick, co-founder of the Raptor Center, and are taught to veterinarians around the world. When treating wild animals, there is very little room for less than perfect results. Restoration of normal function is critical for life in the wild, and often these birds are not willing patients. Care must be taken at all times not to stress them any more than is necessary. Stress is known to slow healing and recovery, as well as increase susceptibility to disease. These powerful birds are also capable of accidentally injuring themselves while in captivity. The ultimate challenge may be preventing new problems from developing before the original ones mend. Safely managing wild raptors in a hospital situation is as much an expertise as the medical skills to treat their injuries. Eventually, the time comes that a raptor's wounds are healed, its illness cured. It's not a matter, however, of just releasing them back to the wild. Raptors are supreme athletes that catch food in the air, on the ground, and in the water by chasing, pouncing, gliding, and diving from great heights. Exceptional physical condition is required. Once a raptor recovers from its illness or injury, it graduates to a rigorous outdoor physical reconditioning program. This process complements the expert medical care provided by the Raptor Center and is critical to a raptor's survival when returned to the wild. To prepare raptors for their exercise session, leather straps called jesses are attached to their lower legs, and a line or creance is attached to the jesses. The birds are transported to an open grassy space and encouraged to fly repeatedly from the center. As they fly, their performance is evaluated. Wing extension, leg and tail position, height, ability to turn in both directions, and endurance are all noted. They are exercised 2 to 4 times per week, and when first starting out in their program are often stiff and tire quickly. With time, their mechanics improve and their level of fitness increases. Once they meet the Raptor Center standards for strength and endurance, they are ready for release. In an area with appropriate habitat, they take off from human hands one last time, stretching their wings farther and higher with the gift of freedom. It is an amazing feeling to be able to send a rehabilitated raptor back into the wild. It is both humbling and awe-inspiring. As the bird soars off into the skies, and we remember its journey to get there, we are reminded of our own relationship to the natural world. How small we are, yet responsible for so much.